What is the primary difference between the terms opacity and contrast when interpreting radiographs, and how do they influence the diagnostic quality of an X-ray image? Answer: opacity and contrast are both critical concepts in radiographic imaging, but they refer to different aspects of an image. Opacity refers to the degree to which a structure on the radiograph obstructs the passage of X-rays. Structures that are more opaque, g. bones, absorb more X-rays and appear white on the radiograph, whereas structures with lower opacity, e.g. lungs, soft tissues, allow more X-rays to pass through and appear darker. Contrast, on the other hand, is the difference in opacity between adjacent structures in the image. It helps to differentiate between various tissues or abnormalities. Higher contrast results in distinct differentiation between tissues, while low contrast may make it difficult to distinguish structures, leading to less clear diagnostic images. Proper positioning and exposure settings are required to achieve the appropriate contrast, ensuring that the radiograph provides a clear depiction of the anatomy or pathology being examined. Regulations and guidelines. The American College of Veterinary Radiology (ACVA) emphasizes the importance of proper radiographic technique to achieve both optimal opacity and contrast for diagnostic clarity. The Radiation Control for Health and Safety Act mandates safety standards for radiographic equipment to ensure consistent image quality. When preparing an animal for an abdominal ultrasound, what are the key considerations to ensure high-quality images and minimize patient distress? Answer: preparing an animal for an abdominal ultrasound involves several steps to ensure that both the animal's comfort and the quality of the diagnostic images are optimized. Fasting is essential to withhold food from the animal for 1 to 4 hours prior to the ultrasound. This helps reduce gastrointestinal gas, which can interfere with the clarity of the ultrasound images. Sedation, while not always necessary, sedation may be used in anxious or aggressive animals to minimize movement and enhance image clarity. Positioning: the animal should be positioned on its back or side depending on the area to be scanned. The abdominal region should be shaved to provide a clear view of the organs. Gel application: a generous amount of ultrasound gel should be applied to the abdomen to ensure good acoustic cupping between the skin and the ultrasound probe. Warmth and comfort: keeping the animal warm and comfortable during the procedure is important, as cold can cause the animal to tense up, affecting the scan quality. Mr. Thompson is a veterinary technician at a clinic that has recently acquired a CT scanner. He is asked to prepare a dog for a CT scan due to a suspected brain tumor. What are the primary steps he should take to ensure the CT scan is performed correctly and safely? Answer: Mr. Thompson should follow these critical steps. Patient assessment: before the procedure, a thorough history and physical examination should be conducted. Ensure the dog is stable enough for anesthesia, as most CT scans require the patient to be under general anesthesia to avoid movement during the scan. Anesthesia preparation: the dog should be premedicated with appropriate sedatives or anesthetics as per the clinic's protocol. Monitoring equipment should be prepared to track vital signs throughout the procedure. Positioning the dog correctly in the CT scanner is essential. The area of interest: in this case, the brain should be aligned with the scanner's axis to obtain the best images. Appropriate padding should be used to prevent the dog from moving. Radiation safety: since CT uses X-rays, radiation safety protocols should be followed to minimize exposure. Protective gear, e.g. lead aprons, should be used when possible, and the exposure settings should be adjusted for the size and condition of the dog. Communication: throughout the process, Mr. Thompson should ensure the veterinary team communicates effectively, especially regarding anesthesia depth and equipment calibration. Explain how the principles of X-ray attenuation relate to the formation of a radiographic image, and what are the key factors that influence attenuation in veterinary radiology? Answer: X-ray attenuation refers to the reduction in the intensity of X-rays as they pass through matter. This process occurs due to two main factors: absorption and scattering. Different tissues in the body attenuate X-rays to varying degrees based on their density and atomic composition. Bone has a high atomic number and density, causing significant attenuation and appearing white, radiopaque on the X-ray film. Soft tissue and fat have lower atomic numbers and densities, resulting in less attenuation and appearing darker, radiolucent on the X-ray film. And the lungs, for example, causes minimal attenuation and appears very dark on the radiograph. Key factors influencing attenuation include X-ray energy (kVp). Higher energy X-rays penetrate tissues more effectively, leading to a lower degree of attenuation. Tissue composition: tissues with higher atomic numbers, e.g. bone, absorb more X-rays, leading to greater attenuation. Thickness of the tissue: thicker tissues attenuate more X-rays. A veterinary technician is reviewing a radiograph of a dog with suspected hip dysplasia. The radiograph shows an unusually wide joint space and subluxation of the femoral head. What conclusions can be drawn from these findings, and what steps should be taken next in diagnosing the condition? Answer: the findings of a wide joint space and femoral head subluxation are consistent with hip dysplasia, a common developmental condition in dogs, particularly in larger breeds. The radiographic evidence suggests that the hip joint is not fitting properly within the acetabulum, leading to abnormal joint movement and wear. Steps for further diagnosis: review of history and symptoms. The veterinarian should review the animal's clinical history and symptoms, such as limping, difficulty rising, or decreased activity level. Confirmatory imaging, additional radiographic views, e.g. von Röntgen view, or advanced imaging like CT may be used to assess the degree of hip dysplasia and associated joint degeneration. Consideration of treatment. Depending on the severity, treatment options include medical management, e.g. anti-inflammatory medications, or surgical intervention, e.g. total hip replacement. Regulations and guidelines. The PenHip Hip Joint Indexing Program provides a specific protocol for evaluating hip dysplasia in dogs, including standard radiographic views and measurements. What are the key advantages of using MRI over CT for soft tissue imaging in veterinary medicine, and when should MRI be preferred? Answer: MRI is particularly advantageous for imaging soft tissues due to its superior contrast resolution compared to CT. While CT is excellent for visualizing bone structures and identifying fractures, MRI excels in soft tissue imaging, including the brain, spinal cord, muscles, and organs. Advantages of MRI: higher soft tissue contrast. MRI provides better differentiation between different soft tissues, making it the preferred choice for evaluating neurological conditions, tumors, and soft tissue injuries. No ionizing radiation. Unlike CT, MRI does not use ionizing radiation, making it safer for repeated imaging, especially in pediatric or highly sensitive animals. Multiplanar imaging. MRI allows for the acquisition of images in multiple planes, axial, sagittal, coronal, offering more detailed information about the location and extent of pathology. When to prefer MRI, MRI should be preferred in cases where detailed soft tissue differentiation is needed, such as neurological disorders, e.g. brain or spinal cord disease, or soft tissue tumors. CT may still be used for skeletal issues or when speed is essential. In preparing a cat for a thoracic radiograph, what are the correct positioning guidelines to ensure high-quality images, and why is correct positioning critical? Answer: correct positioning is crucial for obtaining diagnostic quality radiographs and minimizing patient distress. For a thoracic radiograph in a cat, positioning the cat lateral view. Place the cat in a right lateral recumbency. Ensure the thoracic spine and sternum are parallel to the image receptor. Dorsoventral view. The cat should be placed in ventral recumbency with the front limbs extended cranially and hind limbs extended caudally to reduce motion and ensure accurate image representation. Breathing. The radiograph should be taken at full inspiration to maximize lung expansion and visualize lung fields clearly. Collimation. The area of interest should be collimated to avoid excessive radiation exposure. Why positioning matters. Proper positioning ensures that the anatomy is aligned correctly, preventing distorted or misleading images. It also minimizes the need for retakes, reducing the animal's exposure to radiation. Describe the role of Doppler ultrasound in evaluating blood flow in animals, and how can it aid in diagnosing vascular conditions? Answer: Doppler ultrasound uses sound waves to measure the velocity of blood flow within vessels. It is particularly useful for assessing vascular conditions such as heart disease. Doppler ultrasound can help diagnose conditions like heart murmurs and valvular insufficiency by detecting abnormal blood flow patterns. Vascular obstructions. It can detect narrowing or occlusion of blood vessels, such as in thrombosis or arterial stenosis. The technique involves both color Doppler to visualize the flow direction and relative velocity, and spectral Doppler to measure the actual flow velocity. Regulations and guidelines. The American College of Veterinary Internal Medicine (ACVIM) provides specific protocols for using Doppler ultrasound to assess cardiovascular conditions, ensuring accurate diagnosis and treatment planning. Explain how the principle of beam divergence affects the quality of a radiograph, and what steps can be taken to minimize its impact on imaging. Answer: beam divergence refers to the spreading of the X-ray beam as it travels away from the tube, leading to a loss of image sharpness, especially at the periphery of the image. To minimize the effects of beam divergence, the following steps should be taken. Use of collimators. Collimators help restrict the X-ray beam to the area of interest, reducing unnecessary exposure and minimizing beam divergence. Optimal source-to-image distance (SID). Increasing the distance between the X-ray source and the image receptor helps reduce the impact of beam divergence, producing sharper images. Proper positioning. Correctly positioning the animal and the X-ray beam ensures that the area of interest is aligned with the receptor, reducing distortion. Regulations and guidelines. The National Council on Radiation Protection and Measurements (SCRP) provides guidelines for minimizing exposure and maximizing image quality through proper collimation and positioning. Mrs. Taylor brings a 4-year-old Labrador, Max, to the clinic for an MRI of his knee due to suspected ligament injury. Max is extremely anxious and difficult to handle. What steps should the veterinary technician take to ensure Max's safety and comfort during the MRI procedure? Answer: to ensure Max's safety and comfort, the technician should follow these steps. Pre-scan preparation. Sedate Max to reduce anxiety and prevent movement during the procedure. Pre-sedation medication should be chosen carefully to avoid adverse effects during MRI, as some sedatives can interfere with imaging. Positioning. Properly position Max in the MRI machine, ensuring the injured knee is aligned with the imaging plane for accurate evaluation. Monitoring. Continuously monitor Max's vital signs during the procedure, especially if under sedation, to ensure safety. Safety protocols. Since MRI involves strong magnetic fields, ensure that all metal objects are removed before entering the MRI room. Regulations and guidelines. The American College of Veterinary Radiology (ACVA) provides specific guidelines for MRI procedures, including safety measures related to anesthesia and handling sensitive patients. Explain how inhalant anesthetics, such as isoflurane, produce general anesthesia in animals. Discuss their mechanism of action at the cellular level and any potential risks associated with their use. Answer: inhalant anesthetics like isoflurane produce general anesthesia by binding to specific receptors in the central nervous system, particularly those involved in neurotransmission such as GABA receptors. Isoflurane enhances the inhibitory effects of gamma-amine butyric acid GABA by increasing chloride ion influx into neurons, resulting in hyperpolarization and decreased neuronal excitability. The action on other receptors, such as NMDA receptors, also plays a role in its anesthetic effects. While isoflurane is generally considered safe, it has potential risks, such as cardiovascular depression, reduced heart rate and blood pressure, respiratory depression, hypoventilation, and the potential for toxic effects on the liver and kidneys, particularly in animals with pre-existing conditions. Adequate monitoring of vital signs, heart rate, blood pressure, respiratory rate during anesthesia is essential to manage these risks. Additionally, guidelines from the American College of Veterinary Anesthesia and Analgesia recommend that animals undergoing general anesthesia be closely monitored for signs of overanesthesia, e.g. bradycardia, hypotension, or under anesthesia, e.g. movement, increased heart rate. Mr. Johnson, a veterinary technician, is preparing an older dog for surgery. The dog has a history of heart disease and is on medication for hypertension. What pre-anesthetic assessments should Mr. Johnson conduct, and how should he adjust the anesthetic plan based on the findings? Answer: Mr. Johnson should conduct a thorough pre-anesthetic assessment, which includes obtaining a complete history including medications, a physical examination, and laboratory tests. Given the dog's history of heart disease and hypertension, specific assessments should focus on cardiovascular health, history, and medication review. Determine if the dog is taking any medications that could affect anesthesia, such as beta blockers or SE inhibitors, which may influence heart rate and blood pressure. Discontinuing certain medications before surgery may be necessary. Physical exam. Perform a comprehensive physical exam to assess the cardiovascular system, e.g. heart rate, rhythm, murmurs, pulses, auscultate for abnormal heart sounds, and evaluate respiratory function. Laboratory tests. Complete blood count, CBC, chemistry panel, and a CG to assess heart function, electrolyte balance, and overall health. Blood pressure measurement is particularly important to evaluate the degree of hypertension. Adjustments to anesthetic plan. Based on the findings, Mr. Johnson may need to adjust the anesthetic protocol by choosing drugs with minimal cardiovascular effects. For example, he may select a balanced anesthesia approach with both inhalant agents, e.g. isoflurane, and opioid analgesics, e.g. morphine, to reduce the need for high doses of anesthetics that could further depress heart function. The use of pre-anesthetic medications like benzodiazepines, e.g. diazepam, to reduce anxiety and avoid sudden cardiovascular stress is also advisable. The American Animal Hospital Association (AHA) guidelines recommend that animals with known heart disease undergo a risk assessment and that anesthesia be tailored to minimize risks, particularly through controlled drug choices and monitoring. What are the key vital signs that must be monitored during general anesthesia, and what are the signs of over-anesthesia and under-anesthesia? Answer: during general anesthesia, key vital signs that must be monitored include heart rate (HR), monitored to assess the animal's cardiovascular status. A heart rate that is too low or high may indicate under anesthesia or over anesthesia, respectively. Respiratory rate (RR). This indicates the animal's ventilation status. Hypoventilation, decreased RR, can occur with over anesthesia and requires immediate intervention. Blood pressure (BP). Monitoring blood pressure helps to assess cardiovascular function. Low blood pressure hypotension can result from excessive anesthetic depth, while high blood pressure hypertension could indicate under anesthesia or stress. Oxygen saturation (SPO). Oxygen saturation should be kept above 95% to ensure adequate oxygen delivery to tissues. A drop in oxygen saturation can indicate respiratory depression or hypoventilation. Signs of over-anesthesia: bradycardia, heart rate 60 EPM in most animals, hypotension, systolic BP 8G, hypoventilation or apnea. Absence of response to noxious stimuli, G. Surgical stimulation, pale mucous membranes and delayed capillary refill time. Signs of under anesthesia: tachycardia, heart rate 160 ppm in dogs, hypertension, increased respiratory rate or irregular breathing pattern, movement or purposeful reactions to surgical stimuli, inadequate muscle relaxation or exaggerated reflexes. Guidelines from ACVAA and veterinary anesthesia and analgesia emphasize that monitoring equipment such as a pulse oximeter, capnograph, and blood pressure cuff is essential during any procedure involving general anesthesia to detect early signs of over or under anesthesia and adjust the anesthetic depth accordingly. How do NSAIDs, opioids, and local anesthetics differ in their mechanisms of action, and when should each be used in a veterinary setting? Answer: NSAIDs, opioids, and local anesthetics each work through different mechanisms to provide pain relief. NSAIDs, non-steroidal anti-inflammatory drugs. NSAIDs, such as carprofen, work by inhibiting cyclooxygenase (COX) enzymes, which are responsible for producing prostaglandins, compounds that promote inflammation and pain. By blocking COX-2, NSAIDs reduce inflammation and provide analgesia, particularly for musculoskeletal pain and postoperative discomfort. NSAIDs should not be used in animals with a history of gastrointestinal ulcers, kidney disease, or liver dysfunction. Opioids. Opioids, such as morphine or fentanyl, act on opioid receptors mu, kappa, and delta in the central nervous system, altering the perception of pain and increasing the pain threshold. Opioids are potent analgesics and are used for acute pain management, especially post-surgery or in severe pain. They have a potential for sedation and respiratory depression, so careful monitoring is necessary. Local anesthetics. Local anesthetics, such as lidocaine or bupivacaine, block sodium channels in nerve fibers, preventing action potentials and thereby interrupting the transmission of pain signals. They are used for localized pain relief, either during surgery or in the management of localized injuries. Local anesthetics can be used in combination with other analgesics for enhanced pain control. In practice, these drugs are often used in combination to provide multimodal pain relief, which is more effective than using a single agent. The veterinary anesthesia guidelines emphasize the importance of assessing pain based on the type of surgery, the animal's health status, and the pain level before selecting the most appropriate analgesic regimen. Ms. Rivera, a veterinary technician, is caring for a cat following an orthopedic surgery. The cat is showing signs of discomfort, such as vocalizing restlessness and a decreased appetite. What steps should Ms. Rivera take to manage the post-operative pain, and what factors should she consider when choosing an analgesic regimen? Answer: Ms. Rivera should first perform a thorough pain assessment using a validated pain scale, e.g., the Glasgow Composite Measure Pain Scale, to evaluate the severity of the cat's pain. Signs such as vocalizing, restlessness, and anorexia are common indicators of pain in cats. Pain management plan. Ms. Rivera should initiate a multimodal analgesia approach, which involves combining different classes of pain relievers to provide more effective pain control with fewer side effects. NSAIDs. A COX-2 selective NSAID like meloxicam can be used for its anti-inflammatory and analgesic properties. However, care must be taken with cats, as NSAIDs can have adverse effects on renal function, particularly in dehydrated animals. Opioids. An opioid like buprenorphine may be used for its moderate analgesic effect and longer duration of action. It is safer in cats compared to other opioids like morphine. Local anesthesia. If the surgical site allows MS, Rivera may consider administering the local anesthetic e.g. bupivacaine for regional analgesia to complement systemic drugs. Monitoring and adjustment. Regular monitoring is essential to assess the effectiveness of pain relief. If the cat's signs of pain persist, the dosage or type of analgesic may need adjustment. The International Association for the Study of Pain (IASP) recommends reassessment every 2 to 4 hours for postoperative pain management to adjust the treatment as needed. Non-pharmacological methods (MS). Rivera should also consider non-pharmacological methods such as providing a quiet, comfortable environment and offering food and water at regular intervals to encourage eating. Discuss the importance of using pain scales in veterinary practice and explain the differences between the Glasgow Composite Measure Pain Scale and the Simple Descriptive Scale (SDS) for pain assessment in animals. Answer: pain scales are vital tools in veterinary practice for assessing and quantifying the level of pain an animal is experiencing. These scales provide a standardized method for clinicians to evaluate pain and guide decisions on the most appropriate pain management plan. Glasgow Composite Measure Pain Scale (CMPS). The Glasgow CMPS is a validated pain assessment tool that evaluates pain through behavioral and physiological indicators. It includes subscales that assess the animal's posture, facial expressions, vocalizations, and response to palpation. It is widely used in clinical settings for its reliability and accuracy in various species, including dogs and cats. The scale ranges from 0, no pain, to 24, severe pain, and it helps in making objective decisions about pain management protocols. Simple Descriptive Scale (SDS). The SDS is a more straightforward tool where the clinician rates pain on a scale of 0, no pain, to 3, severe pain. It is less detailed compared to the Glasgow scale and is generally used for quick assessments or in cases where detailed behavioral observations are impractical. It is often used in conjunction with other clinical assessments. Explain the role of capnography in anesthesia monitoring and how does it help detect early signs of respiratory or metabolic abnormalities during surgery. Answer: capnography is the monitoring of exhaled carbon dioxide levels, and it plays a crucial role in anesthesia monitoring by providing real-time information about an animal's respiratory status. The capnogram provides a visual representation of levels during the breathing cycle, helping to identify early signs of respiratory depression or metabolic abnormalities. Detecting hypoventilation. A rising level of in the exhaled air is an early indicator of hypoventilation, which may occur due to overanesthesia, respiratory depression, or insufficient ventilation. This allows the anesthesia team to adjust ventilator settings or modify the anesthetic protocol before the condition worsens. Detecting hypocapnia. Elevated levels may also signal issues like metabolic acidosis, which can occur with prolonged hypoventilation. The capnogram provides continuous data that can help diagnose and address the issue immediately. Guidelines. The Veterinary Anesthesia and Analgesia Guidelines recommend using capnography alongside other vital signs monitoring to improve patient safety during anesthesia. The normal and tidal echo range in animals is generally between 35 and 40 ft. Discuss how anesthesia affects cardiovascular function and what specific measures should be taken to minimize risks in animals with cardiovascular disease. Answer: anesthesia can affect cardiovascular function by causing vasodilation, reducing myocardial contractility, and altering the balance of electrolytes, all of which can result in hypotension, bradycardia, and arrhythmias. Animals with pre-existing cardiovascular disease are a higher risk of these complications, requiring special attention. Vasodilation and hypotension. Anesthetic agents, particularly inhalant agents like isoflurane, cause vasodilation, which can lead to a drop in blood pressure. This is especially dangerous for animals with compromised heart function. Bradycardia. Many anesthetic drugs can cause bradycardia by depressing the synovial node. Animals with heart disease may already have a low heart rate, so additional bradycardia may result in inadequate tissue perfusion. Monitoring and management. In animals with cardiovascular disease, pre-anesthetic assessment e.g. blood pressure is essential. Balanced anesthesia protocols, including using agents that do not overly depress the cardiovascular system e.g. propofol or etomidate, can help mitigate these risks. Intraoperative monitoring of vital signs is crucial to detect early signs of cardiovascular instability. Positive inotropes e.g. dobutamine or vasopressors e.g. ephedrine may be used if necessary to support cardiovascular function. Discuss the considerations for anesthesia in geriatric animals, highlighting specific anesthetic protocols and monitoring strategies. Answer: geriatric animals often have compromised organ function, including reduced renal, hepatic, and cardiovascular function. These factors can affect drug metabolism and elimination, making anesthetic management more challenging. Pre-anesthetic assessment: geriatric animals should undergo a thorough pre-anesthetic evaluation, including blood work, CBC, liver and kidney function tests, and ECG. The American Veterinary Medical Association (AVMA) recommends baseline diagnostic tests to assess organ function before anesthesia in older animals. Anesthetic agents: short-acting and reversible anesthetic agents such as propofol or fentanyl are preferred in geriatric animals to minimize prolonged drug effects. Inhalant agents like isoflurane are commonly used due to their controlled depth of anesthesia. Monitoring: continuous monitoring of heart rate, blood pressure, oxygen saturation, and respiratory rate is critical. Capnography and ECG monitoring are also recommended for early detection of any cardiovascular or respiratory issues. Describe the challenges associated with pain management in exotic animals, such as reptiles, and how you would tailor your approach to these species. Answer: exotic animals, such as reptiles, present unique challenges in pain management due to their different physiology and behavior compared to mammals. Reptiles, for example, are ectothermic, meaning their body temperature can affect the efficacy of anesthetic agents and pain medications. Assessment: pain is difficult to assess in reptiles due to their subtle behavior. Clinical signs may include lethargy, reduced feeding, or abnormal postures. The pain assessment tool used for reptiles, e.g., Reptile Pain Scale, relies on physical observations and changes in behavior. Anesthetic protocols: reptiles often require induction with injectable agents, e.g., ketamine or propofol, rather than inhalants, as they can have difficulty with inhalant gas delivery. Pain management strategies should be tailored to each species' metabolic rate, which is often slower in reptiles. Non-pharmacological approaches: in addition to analgesics, maintaining the appropriate temperature is essential for optimal drug efficacy. Environmental control, e.g., temperature, humidity, can help support recovery and pain management. A veterinarian requests a complete blood count, CBC, to assess a dog that is showing signs of lethargy and pale gums. The CBC shows a low hemoglobin concentration and a decreased hematocrit level, while the white blood cell count is normal. Based on these results, what is the most likely diagnosis and what further steps should be taken for diagnosis? Answer: the most likely diagnosis is anemia, as indicated by the low hemoglobin and hematocrit levels. Anemia can be classified into different types, such as regenerative or non-regenerative, based on whether the bone marrow is responding to the loss of red blood cells. To determine the underlying cause, further tests should include reticulocyte count to determine if the bone marrow is regenerating red blood cells, indicating a regenerative anemia. Blood smear examination to check for signs of hemolysis, e.g., spherocytes in immune-mediated hemolytic anemia, or blood parasites, e.g., Bibija. Bone marrow aspirate if the anemia appears non-regenerative, which may suggest bone marrow disease. A relevant rule: the veterinary technician should adhere to guidelines for proper blood sample collection and transport to ensure accurate results. Mr. Stevens brings his cat Whiskers to the clinic for a routine checkup. During urinalysis, you find a high specific gravity, 1.35, a small amount of protein, and no glucose. What could these findings suggest, and what should be done next? Answer: the high specific gravity suggests that the kidneys are concentrating urine, which may be a sign of dehydration or kidney disease. The presence of protein in the urine, though small, may indicate early kidney dysfunction, especially in cases of chronic kidney disease (CKD). The absence of glucose rules out diabetes mellitus. Next steps: recheck urine after proper hydration to determine if the high specific gravity persists. Evaluate urine protein to creatinine ratio to assess for proteinuria, which is an early indicator of kidney damage. Evaluate kidney function through blood tests for creatinine and blood urea nitrogen (BUN). Relevant rule: veterinary professionals should follow standard protocols for urinalysis interpretation, ensuring proper handling and storage of urine samples to avoid false results. MS. Green brings her dog Rex to the clinic with a swollen mass on his flank. A fine needle aspiration (FNA) is performed, and the cytology report shows numerous large, pleomorphic cells with prominent nucleoli. Based on the cytology findings, what is the most likely diagnosis and what steps should be taken next? Answer: the presence of large, pleomorphic cells with prominent nucleoli is highly suggestive of a malignant tumor, possibly a sarcoma or carcinoma. The next steps should include referral to a veterinary oncologist for further diagnostic testing, including imaging, e.g. radiographs, ultrasound to assess for metastases, histopathology to confirm the tumor type and grade, which is crucial for prognosis and treatment planning, staging tests, e.g. lymph node biopsy, chest x-ray, to determine if the cancer has spread. Relevant law. Under veterinary ethical guidelines, it is essential to ensure that informed consent is obtained from the pet owner before conducting procedures like FNS and biopsies. A veterinarian suspects a bacterial infection in a dog with a chronic wound. A swab of the wound is cultured and the resulting bacterial growth is identified as Staphylococcus aureus. The antibiotic sensitivity test shows resistance to penicillin. What is the appropriate course of action and why? Answer. Since Staphylococcus aureus is resistant to penicillin, it is important to select an alternative antibiotic based on the results of the antibiotic sensitivity test. Common alternatives for resistant S. aureus infections may include cephalosporins or clindamycin if the organism is sensitive to these antibiotics, methicillin if the strain is methicillin sensitive. If resistance is broader, e.g. methicillin-resistant S. aureus, vancomycin or linezolid might be needed. The veterinarian should also consider a more aggressive treatment approach such as wound debridement and possibly employing local antiseptic treatments. Relevant rule. Antibiotic stewardship guidelines emphasize selecting the most appropriate antibiotic based on culture and sensitivity testing to prevent resistance. What is the most likely cause of a dog with a normocytic, normochromic anemia and a low reticulocyte count, and how should the condition be further managed? Answer. A normocytic, normochromic anemia with a low reticulocyte count typically points to non-regenerative anemia, which can be caused by bone marrow disease, chronic disease, or nutritional deficiencies, e.g. iron or vitamin B deficiency. In this case, the most likely cause is bone marrow suppression, potentially due to chronic kidney disease, common cause of non-regenerative anemia due to erythropoietin deficiency, bone marrow neoplasia or toxicity, e.g. from drugs like chemotherapy. Next steps include serum creatinine and BUN tests to evaluate kidney function, bone marrow aspirate if a neoplastic process is suspected. Relevant guideline. Veterinary technicians should follow guidelines for handling blood and bone marrow samples, ensuring proper collection and submission for analysis. A cytology sample of a liver aspirate shows cells with vacuolated cytoplasm, suggesting lipidosis. What does this finding indicate, and what is the likely cause of the condition? Answer. The presence of vacuolated cytoplasm in liver cells is indicative of hepatic lipidosis. This condition typically occurs due to an accumulation of fat within the liver cells. The most common cause of hepatic lipidosis in cats is idiopathic, though it can be secondary to conditions like diabetes mellitus, pancreatitis, or obesity. Next steps should include ultrasound or radiographs to assess the liver for enlargement or other abnormalities. Blood tests to evaluate liver function, e.g. ALT, AST, bilirubin, and check for concurrent diseases like diabetes. Relevant rule. Veterinary technicians should follow standard operating procedures for cytology preparation and handling to avoid contamination. A dog presents with coughing, nasal discharge, and fever, a PCR test detects Bordetella bronchoseptica. What is the significance of this result, and what are the treatment options? Answer. Bordetella bronchoseptica is a gram-negative bacterium that is a primary cause of kennel cough, canine infectious tracheobronchitis. The PCR test confirming the presence of Bordetella is highly significant because this pathogen is highly contagious and commonly found in environments with multiple dogs, such as kennels, dog parks, or animal shelters. It is an opportunistic pathogen that primarily affects the respiratory system, causing symptoms such as coughing, nasal discharge, fever, and in more severe cases, pneumonia. Although Bordetella can be self-limiting in healthy dogs, treatment may be necessary to alleviate symptoms and prevent secondary infections. The treatment options include antibiotics. The veterinarian may prescribe antibiotics such as doxycycline, amoxicillin, clavulanate, or trimethoprim sulfonamide based on the clinical severity and the results of culture and sensitivity tests. Antibiotics target secondary bacterial infections that often complicate the disease. Cough suppressants and bronchodilators, hydrocodone or butorphanol may be used to control coughing, while bronchodilators, e.g. albuterol, may help open the airways and ease breathing. These treatments improve comfort but are typically used as adjuncts to antibiotics, supportive care, humidifiers, steam therapy, and maintaining a comfortable, calm environment can help relieve respiratory distress. Ensuring the dog is well hydrated and has access to easy food and water is essential for recovery. Vaccination. Bordetella bronchi septica vaccines are available and commonly recommended for dogs that are at high risk, such as those in shelters or boarding facilities. However, vaccination is not 100% protective, and infected dogs should still be isolated to prevent transmission to others. A dog with a history of diabetes mellitus presents with dark yellow urine and increased thirst. Urinalysis reveals ketones in the urine. What is the most likely diagnosis, and what should be the next step in management? Answer: the presence of ketones in the urine alongside clinical signs such as increased thirst, polydipsia, and dark yellow urine strongly suggests diabetic ketoacidosis (DKA), a life-threatening complication of diabetes mellitus. DKA occurs when the body, unable to use glucose effectively due to insulin deficiency, starts breaking down fats for energy. This process results in the production of ketones, which can accumulate in the bloodstream and urine, leading to severe metabolic disturbances. The next step in management is immediate hospitalization, as DKA requires prompt and aggressive treatment to correct electrolyte imbalances, rehydrate the animal, and normalize blood glucose levels. The treatment protocol for DKA includes intravenous Romainoids. IV fluids are critical to rehydrate the patient, correct electrolyte imbalances, especially potassium, and dilute the ketones in the blood. Crystalloids like LRS, lactated Ringer solution, or normal saline are typically used. Insulin therapy. Regular insulin should be administered intravenously to lower blood glucose levels gradually. The rapid reduction in glucose could lead to cerebral edema, so glucose levels should be corrected slowly. Monitoring. Frequent monitoring of blood glucose, ketones, electrolytes, and urine output is essential. Adjustments to insulin dosages and fluid therapy will be made based on these parameters. Electrolyte correction. Potassium is often depleted in DKA patients, so potassium supplementation is crucial, especially as insulin drives potassium into cells. Once the acute crisis is managed, further diagnostic tests should be performed to assess the underlying cause of the diabetes, including blood work fructosamine, which reflects longer-term glucose control, and an evaluation for concurrent conditions such as pancreatitis or infections. Mr. Lee brings his cat, Momo, to the clinic with signs of coughing and difficulty breathing. Upon examination, the cat's vitals are stable, but lung auscultation reveals crackles and wheezes. The veterinarian suspects feline asthma. As a veterinary technician, what steps would you take to assist in the diagnosis and management? Answer: to assist in the diagnosis of feline asthma, the veterinary technician should assist with collecting a sample for cytology from bronchoalveolar lavage bowel to confirm inflammation and rule out other causes of respiratory distress. Perform radiographic imaging to assess for changes in the lungs associated with asthma, such as bronchial patterns or hyperinflation. Support oxygen therapy and prepare bronchodilators, e.g. albuterol if needed. Following diagnosis, the technician can assist in administering corticosteroids and inhalers as part of long-term asthma management. Relevant guideline. Veterinary technicians should ensure proper handling of inhaler devices, as these require precise techniques to administer medication effectively. A veterinary technician prepares a cytology sample from a dog with a suspected skin mass. The cytology shows clusters of round cells with central nuclei and abundant clear cytoplasm, characteristic of a mast cell tumor. What is the next step in diagnosing and managing this case? Answer: the cytology strongly suggests a mast cell tumor (MCT). The next steps include histopathology. This is necessary to confirm the diagnosis and grade the tumor, as MCTs can range from benign to malignant. Staging. Staging tests such as fine needle aspirates of regional lymph nodes and imaging, radiographs, ultrasound should be performed to check for metastases. Surgical excision. This is the primary treatment for localized SCTS. Ensuring wide margins is important to remove the tumor completely. Chemotherapy or radiation therapy. If the tumor is high-grade or metastatic, these treatments may be necessary. These steps help determine the tumor's behavior and guide the treatment plan. Relevant guideline. Proper sample collection and handling are crucial for accurate cytological diagnosis.